IHC labs have now processed more than 1 million COVID-19 tests since they developed and finalized their method just about a year ago. It was late last February when they began the testing process in earnest, and boy, it has been off and running ever since. Healthcare officials say testing started out at a fairly slow pace, but has picked up rapidly over the past several months. Now, most of the tests have been conducted on patients in Utah and the Intermountain West. And in the first few months, tests typically taking around 3 days to come back with a result. Well, now the vast majority are done in a day, less than 24 hours typically. Medical experts say this is all very significant because they need to know where the enemy is in terms of this virus and how quickly it's spreading so they can actively fight against it. And while this is all really good news, they also say we cannot let our guard down yet.
There's a lot of things to be optimistic about. We're at a very different place than we were a year ago, but we have some work ahead of us still. So it's very important for us to maintain use of masks and social distancing and do the right things to limit and minimize prevent spread of this virus in the communities.
Dr. Lopensari says we are now basically in a foot race between testing and vaccine distribution. On top of that, they want to make sure that they're able to stay on top of some of the variant forms of the disease that are now popping up here in Utah and really all over the U.S. And so, it kind of sounds like a broken record, but you heard the doctor say it there in his interview. This is no time to let down your guard, to remain diligent, and do things like frequent hand washing, wearing face coverings, and maintaining safe social distance. I know it sounds kind of tired and trite, but they say it's working, and it will continue to work as they continue to ramp up testing and the vaccine distribution. For now, we're live in Murray. Scott McCain, Fox 13 News, Utah.